My name is Dylan Prevet. I'm a student physical therapist at Campbell University, and I'm going to talk about central and unilateral anterior lumbar glides with physiological motion. So just a little bit of scientific explanation behind the techniques. Mobilizations in general are intended to increase motion or decrease pain in relation to a specific segment. A force in an anterior direction through the spinous process is thought to assist with sagittal plane motion, such as bending forward and backwards. A force in an anterior direction through the transverse process is thought to assist with rotation and side bending. The idea behind mobilization is to restore normal motion to a joint that might be restricted or painful. Research shows that a painful segment responds better to less force, so grade 1 or 2, whereas stiff or restricted joints require more force that was needed to stretch the joint capsule, such as grade 3 and 4. The role of physiological motion is to encourage further movement at the joint, as well as increase motor control in the new range of motion. For central PAs with physiological motion, you want the patient seated with arms across chest and mobilization belt around the ASIS. The therapist is standing behind the patient with the belt secured at their gluteal folds. The therapist places his thumb or thenar eminence over the spinous process of the segment to be mobilized with their forearm in the line of direction of force. The patient is asked to move into forward bending or backwards bending as the therapist applies a force through the spinous process in an anterior direction. Simultaneously, the therapist keeps pressure against the belt and stabilizes the pelvis. Force is sustained throughout the movement. For the unilateral glide, the same setup occurs as the lumbar glides, with the exception of the hand placement and direction of patient movement. The therapist places the thumb or thenar eminence over the transverse process and applies a force as the patient rotates to the opposite side. So for example, push on the left transverse process and the patient should rotate towards the right. The spine has joints similar to other joints in the body, so sometimes these joints can become stiff or painful because they lack movement. So the purpose of this technique is to increase movement at those joints and hopefully restore normal movement and reduce pain. So you can help me restore your movement in these joints by performing the motion that correlates with the restriction. The belt is going to be placed around your pelvis to keep it from moving while we go through the motion. When I say so, I want you to bend slowly forward like you're trying to take your chest down to the floor and then come back to normal. Then we will go the other way and I want you to stick your belly out and then return to normal. We will do a few sets of these and then we'll take a break. First off, we'll take and wrap the belt around the patient. Find the spinous process, overlap the thumbs. So now patient, I want you to take your chest down towards the floor while I pull back and I'll push in the anterior direction with my thumbs. Now come back up and do the same thing. And now I want you to poke your belly out, still pushing anteriorly with my thumbs and pulling posteriorly with the belt. I want you to help me by rotating to your right.